face. Once we're vaccinated, and everybody gon' be safe. Everybody gon' be safe. One kind, one people. We are roll up to roll out. Cause no man's alone. Do what's right. Cause I love you, brother, my sister. And we're in this together, my sister, my brother. I don't wanna lose you. I love you too much. I think it's better for us, yeah. It's better for us, yeah. I don't wanna lose you. I love you too much, yeah. It's better for us. Tell your mommy to roll out.
Bless up, Dejo here, and I'm doing my part in the fight against COVID-19 by following all safety protocols and, most importantly, rolling up my sleeve for the vaccine. So I'm encouraging you to do the same, because that's our best shot of protecting ourselves, our family, and our friends. So don't wait, vaccinate. Let's roll up to roll out.
Tonight we had another successful town hall meeting in which we engaged the community regarding the vaccination rollout in St. Kitts and Nevis. As of this afternoon, we had just under 6,000 persons who have been vaccinated. That brings us close to 18% of our target population, which we need to have vaccinated to achieve herd immunity. Tonight's session was to bring the information to the people in a manner in which they have the opportunity to share their concerns, to express their fears, and to have them answered by the professional and the experts in the health ministry. I want to commend our Medical Chief of Staff, Dr. Cameron Wilkinson, our Permanent Secretary in Health, Dr. Dolores Stapleton Harris, and of course the District Medical Doctor, Dr. Bernicia Nisbet, for participating in this very rich experience for the people of the community of St. Paul's and the adjoining areas. I think this has been highly successful. We had a sense of joy. We, at the end of the question and answer period, a number of persons moved forward to have their vaccination. That tells me that it was very persuasive, it was impactful, and it has helped. And I know these persons are going to be ambassadors. They're going to be out there with their own experience, sharing with others, and as a consequence, we're going to have more persons participating in the program.
You know, it's me, Mr. HE, and I'm here with one message: roll up to roll out. We all know how difficult things have been during this COVID-19 pandemic. While we continue to wash our hands, wear our face mask, and practice social distancing, how about we take it one step further and get vaccinated? Call the nearest health center to find out if you are eligible to be vaccinated. Or you can contact the Ministry of Health at any one of these numbers down below. Don't be discouraged by the negativity. We all have a role to play in protecting this federation. So, St. Kitts and Nevis, let's roll up to roll out.
Is on.
afternoon and welcome to this National Emergency Operations Center COVID-19 emergency briefing for Wednesday, the 19th of May, 2021. Thank you very much for joining us for our briefing today, whether you have joined us by television, radio, or social media. We continue to update you on what is happening in St. Kitts and Nevis with respect to the management of the COVID-19 pandemic, which is still with us. And we have a responsibility to manage this pandemic as best as we could so that our country is kept safe and secure. Today we have a number of speakers, including the Chief Medical Officer, our Medical Chief of Staff, our Superintendent on the National COVID-19 Task Force, Superintendent Cromwell Henry, and Mr. Abdias Samuel, the Chair of the National COVID-19 Task Force. We are pleased to have in our midst the Honorable Wendy Phipps, who is the Chair of the Disaster Mitigation Council. And additionally, we are pleased to have as well the Commissioner of Police, Mr. Hilroy Brandy. Without further ado, I would invite the Chief Medical Officer to give us the Health Emergency Operations Center situation report.
Thank you, Mr. Williams, and good afternoon, everyone. As per usual, it's my task to share with you the Health Emergency Operating Center Situation Report for today, May 19, 2021. Ladies and gentlemen, the Federation of St. Kitts and Nevis has reported 46 confirmed cases. So we now have a total of 46 confirmed cases of COVID-19. 45 of these cases have fully recovered, and at present, we have one active case. Let me just share some information. The Federation just confirmed its latest case of COVID-19. Case 46 is a national who does not have a travel history. The individual works in the hotel industry. The case is stable and is in isolation as we speak. The Health Emergency Operating Committee had an emergency meeting this afternoon at 2 p.m. and the public health team has been deployed to conduct contact tracing. Our aim is to identify and engage all the contacts of this case. All the contacts will be tested and placed into quarantine immediately. I want to assure you, the public, that all steps are being taken to reduce the risk of exposure to the SARS-CoV-2 virus. Ladies and gentlemen, I would like to use this opportunity to underscore the importance of one, the vaccine, the COVID-19 vaccine that we are administering at this time, and the COVID-19 prevention and control measures, the importance of hand sanitation, the importance of wearing your face mask when in the public space, the importance of physical distancing, making sure that you maintain a 6 feet distance when in the public space, and social distancing, avoiding crowds at this time. These measures are very, very important at this time. The COVID-19 pandemic continues with over 163.3 million confirmed cases globally and over 3.38 million deaths reported. Now, most countries globally have been rolling out their COVID-19 vaccine programs, and to date, over 1.41 billion vaccine doses have been administered globally. In the United States of America, over 32.9 million confirmed cases and over 587,000 deaths have been reported. Now, this slide just provides you an overview of the global status regarding COVID-19 vaccination, with Seychelles and Israel out at the front with a significant proportion of those populations being fully vaccinated. Seychelles 63%, Israel 56%. The United States 38% of that population fully vaccinated, and in terms of the United Kingdom 31%. The virus continues in the Caribbean region. It has impacted over 173,000 persons within the CARICOM member states. The virus continues to impact the Organization of Eastern Caribbean States, where you are seeing a gradual rise or increase in the number of confirmed cases, being over 12,300, and the number of deaths. Here in St. Kitts and Nevis, we continue with our vaccination program. Now, as at yesterday, the island, the Federation, we would have administered 18,695 COVID-19 doses, with over 14,028 in St. Kitts. In Nevis, 4,667. Ladies and gentlemen, we have covered, in terms of administration of the first dose, we've covered 44.2% of the target population with the first dose, and we would have covered over 12.4% of the target population with the second dose. Now, the figures for today just came in, and the next speaker, Dr. Cameron Wilkinson, will provide you the latest figures as of this afternoon. In St. Kitts and Nevis, our surveillance system is quite robust. We continue testing persons who present with signs and COVID-like signs and symptoms, with over 14,000 persons being tested to date, and a positivity rate of about 0.3%. To date, we now have a total of 46 positive cases. Next slide. Again, within the Ministry of Health, our strategy is twofold. Our aim is to reach the herd immunity and vaccinate the adults in our population, which comprise about 70% of our population, and we continue to minimize the risk of exposure to the SARS-CoV-2 virus. Again, I just want to provide some information about the AstraZeneca Oxford vaccine. This is the vaccine that we have available to us. There's a saying that goes, the best COVID-19 vaccine is the one that we have. It's the one that we have access to. Here in the Federation, we have access to the AstraZeneca Oxford vaccine. If you are fully vaccinated, it affords you an 83% risk reduction in terms of contracting the virus. We are utilizing, it's a vaccine that has a 2-dose regimen, and it can be given anywhere between 1 month to, the 2 doses can be given anywhere between 1 month to 12 weeks apart. and it must be administered to persons 18 years and over. At present, this vaccine is being offered to persons, to women or ladies who are breastfeeding or lactating. However, at this time, it's not being offered to pregnant women. Ladies and gentlemen, this vaccine can be given to individuals or persons living with HIV. It can be administered to individuals who are immunocompromised, for example, those individuals who are diabetics and those who are on steroids for other medical conditions. This vaccine can be administered to persons with autoimmune conditions, and it also can be administered to persons who have been diagnosed with COVID-19. So in other words, persons who've had a COVID-19 can be vaccinated. However, the vaccine can be administered anywhere between 2 months to 6 months after the individual would have recovered from COVID-19. This vaccine is WHO approved, it's safe and effective, it works well in older adults, and it has a very wide global reach. In other words, it's being utilized in over 148 countries worldwide, and it provides significant protection against the emerging variants of concern. Now, persons who have received this vaccine, they only complain of mild symptoms, including tenderness at the injection site, chills or feeling cold, mild fever relieved by over-the-counter fever medication. But ladies and gentlemen, the major point I want to make here is that those of us who would have taken the second dose of this vaccine, we hardly experienced anything. In other words, the persons who have received the second dose of the vaccine hardly complained of any signs or symptoms. Probably just mild pain at the injection site, but no, I haven't heard anyone complain of chills or fever. So the side effect profile in terms of this vaccine remains pretty good. Next slide. Just wanted to highlight that there is a travel advisory regarding travelers coming into the Federation from Brazil, the United Kingdom, South Africa, and India. Now, ladies and gentlemen, at present, our public health team, we are investigating or conducting contact tracing with respect to the last case 46, which we just identified. And we do not know the true status. However, what I want to underscore is the importance of the COVID-19 prevention and control measures. Wearing your face mask in public spaces, hand sanitization, social distancing, avoiding crowds, and physical distancing. And most importantly, be empowering yourself with the latest information about the COVID-19 vaccine. And we want to encourage you to make the wise decision of accepting the vaccine, because it provides you protection against the virus. Thank you.
Thank you very much, Dr. Laws. As we continue to roll out our vaccination program, there still is a lot of what I term baloney going around with respect to vaccination. And they're still coming up with things from time to time. The latest thing that they have come up with is that the magnet, and that the magnet is sticking where you would have received the vaccine. Well, I tried that magnet over and over again, and no magnet has stuck on me. So I don't understand it. And these are some of the things that are being circulated. Now, we who are following social media, we have a responsibility not to spread propaganda, not to continue to spread the false news. And so what we can do is that when we see something that is suspicious, when we see something that is propaganda and fake news, what we must do is that we must report it to the social media sites. There's a reporting mechanism. And so therefore, we do not contribute to the misinformation and the disinformation that is being propagated. I now invite our Medical Chief of Staff, Dr. Cameron Wilkinson, to give us a presentation.
Thank you, Leslie. More than 1.53 billion doses of COVID-19 vaccines have been administered worldwide to date. While numerically this is a huge number, vaccines are still relatively scarce globally. Many countries are still only vaccinating priority groups and frontline workers as they do not have enough vaccines to offer to the general public. Some even do not have enough to offer to their frontline workers and are still highly dependent on non-pharmaceuticals to contain the virus and protect themselves. We have said repeatedly that it's only a vaccine that was going to get us out of this crisis, and that we will give our citizens access to a safe and effective vaccine when one was available. We have been very fortunate to have been able to contain this deadly virus for over a year with the prescription of non-pharmaceuticals, while in other countries we saw increasing case counts and deaths. We continually warned that it was only a matter of time before this virus got into our community. Well, the virus is back. We have been fortunate, however, here in the Federation of St. Kitts and Nevis to have access to a vaccine that has proven to be safe and effective. Our vaccine rollout started on February 22nd this year. Despite significant vaccine hesitancy, to date, 14,747 persons came forward and received their first dose, bringing us to 44.6% of the target population. We also now have 4,572 persons who are now fully vaccinated, or 13.8% of the target population. I congratulate them all for doing the right thing in not just protecting themselves, but protecting others. That number could have and should have been higher. We called for an all-of-society approach in this fight, and many stepped forward to aid in this fight and encourage persons to come forward and get vaccinated. Some said that they had no reason to get vaccinated as we had no COVID. Well, I want to make it abundantly clear that the virus is back. You heard that we had a positive case who had no history of travel. We also had, since February 22nd, the tool to fight this deadly virus, the Oxford AstraZeneca vaccine. This vaccine is 70% effective in preventing COVID-19. This vaccine is 76% effective in preventing severe disease and hospitalization after a single dose. This vaccine is 82.4% effective in preventing severe disease and hospitalization after 2 doses. This vaccine is 100% effective in preventing death from COVID-19. We said that you needed to get vaccinated to protect yourself and those who could not be vaccinated and were dependent on you. That is the very young, those below the age of 18, and the very old and frail. For those of us who did the right thing and got vaccinated, we should benefit from the protection offered by the vaccine. This positive case should, however, serve as a wake-up call for all. It should be a wake-up call for those who were hesitating. It should be a wake-up call for those who knew better but refused to encourage others to step forward and get vaccinated. It should be a wake-up call for those who knowingly spread fake news and false information about the vaccines and prevented others from stepping forward. It should be a wake-up call for those who silently took the vaccine and chose not to share the information with others so that they can benefit from the protection. We have said, no one is safe until everyone is safe, and we need everyone on board in this fight. This virus has no respect for age, sex, race, or political affiliation. If you are not vaccinated, it will be coming for you. Our tourism sector cannot safely reopen if the port workers, hotel workers, taxi drivers, and restaurant workers are not fully vaccinated. And you heard that this was somebody in the tourism industry who tested positive. Teachers who we put in charge of our kids who are not eligible to be vaccinated and remain vulnerable to the disease are dependent on the adults around them to be protected, and they should step forward and do the moral thing and get vaccinated. Persons working in institutions like prisons and nursing homes have a moral responsibility to do the right thing and get vaccinated as a matter of urgency, as their inaction can lead to cluster spread in these institutions where they work. Healthcare workers like myself and other essential workers who are in regular contact with the general public have a moral responsibility to protect themselves and those who they serve by getting vaccinated. Our security forces, police and army, who made an oath to protect us, should all protect themselves first by getting vaccinated. Herd immunity benefits society collectively, so it's only fair that the responsibility of reaching it be shared evenly among the individual society members. This one case will not be the only case, as I am certain there are others who were exposed. With our contact tracing and our containment, we should be able to contain this virus as we have done over the past year. Even if we are successful now, more will come and we will again be placed at risk. Our only hope is to get to herd immunity, as that will protect us in this fight against this virus. And so our only hope is that you do not hesitate and get vaccinated. Thank you.
Thank you, Dr. Wilkinson. I now invite Superintendent Cromwell Henry to give us his report.
Thank you very much, Mr. Williams, and a pleasant good afternoon to all listening to this broadcast via whatever means. In light of the announcement made by the CMO, the Chief Medical Officer, and acting on the advice of the National COVID-19 Task Force, the Commissioner of Police has directed that effective immediately, all approved events are cancelled until further notice. Persons with approvals will receive an email shortly reflecting this withdrawal of your permission. Please note also that spectators will not be allowed in stadium at sporting games, as was previously announced. We further advise that all persons adhere to all the non-pharmaceutical COVID-19 prevention measures as stipulated in the COVID-19 Prevention and Control Act. These are the wearing of masks in public, maintaining physical distance of 6 feet, good hand hygiene practices, and avoiding crowds and crowded places. Persons using public transportation are particularly vulnerable to the spread of the virus due to the close seating arrangements in these vehicles. You are therefore strongly advised to observe the provisions of the COVID-19 Prevention and Control Act, which require the driver and all passengers to wear masks for the duration of the journey, and maintain open windows if weather conditions permit. Further, passengers entering these vehicles should be hand sanitized upon entry, and the seats and other high-touch surfaces of the vehicles should be sanitized before and after each trip. The Ministry of Health is presently engaged in a comprehensive contact tracing exercise to identify possible contacts of the latest COVID-19 case. These contacts will be placed in quarantine in an effort to contain or prevent the spread of the virus. We solicit the full cooperation of the public in this exercise. The police and defense forces are mandated to provide support to the Ministry of Health, and we stand ready to ensure that they discharge or are allowed to discharge their responsibility in the interests of public health. The COVID-19 compliance team will be stepping up their compliance enforcement activities to ensure that public health measures are complied with, especially at business establishments and other public spaces. We again call for calm in the public as we go through this period and urge your full support and cooperation with the public health and law enforcement authorities. Thank you.
Thank you very much, Superintendent Henry. I now invite the chair of the COVID-19 Task Force, Mr. Abdias Samuel, to address us. And before he comes, I just wanted to, I should have started with that, to congratulate Dr. Wilkinson, Dr. Laws, and Mr. Samuel for their receiving of the Companion Star of the Merit today at Government House at the investiture ceremony.
Thank you, Mr. Williams, and pleasant good afternoon to all who are watching and listening via all various means. As the chair of the National COVID-19 Task Force, today we would have had an emergency meeting of the task force. This discussion would have highlighted the current situation that has been, information that has been shared by the Ministry of Health. In this regard, the National COVID-19 Task Force, in collaboration with the Ministry of Health and also with the security forces, arrived at a number of recommendations. However, I wish to advise the general public that the response to this particular matter will be swift and thorough. We are requiring the all-of-society approach, and we are requesting that all hands come on deck. Again, I want to reiterate the point that there is no need to panic, there is no need to be fearful. The National COVID-19 Task Force will be implementing the containment strategy to be able to contain any particular development that may come from this particular investigation. We will continue with our crisis management communication strategy to provide you frequent updates and provided with adequate information. Mr. Leslie Williams has been identified as a focal point to disseminate information to the general public. All media houses are encouraged to contact him for any information regarding these matters. Superintendent Cromwell Henry has been designated as the focal point to address matters of security communication. So I'm advising all media houses to communicate your interest for information to these two particular members of the National COVID-19 Task Force. The National COVID-19 Task Force within the next few days will be engaging many stakeholders within society or social partners, and in particular the Chamber Evangelical Association and those who are providing services within the tourism sector, along with the public transportation service providers. We will be engaging you within the next few days to ensure and enforce and have you as part of this response mechanism. As stated by Superintendent Henry, the compliance team will be stepping up their surveillance and enforcement measures. In this regard, I am asking all business places and every citizen, resident, and even visitor within the Federation of St. Kitts and Nevis to comply with the COVID-19 protocols as indicated by the Prevention and Control Act. Please ensure that you do your best to cooperate with the health team that is doing the contact tracing at this time. I want to advise the general public that St. Kitts and Nevis is not going into no lockdown. There are messages going out that we are going into lockdown and that we have community spread. At the present moment, investigations are ongoing as per the usual procedure when a case is identified. So we are simply implementing our containment strategy to ensure that we protect everyone to the fullest extent. We welcome your cooperation and assistance as we do our best to continue to keep St. Kitts and Nevis safe. Thank you very much.
Thank you very much, Mr. Samuel, for that reassurance. We are not going into any lockdown. Now, that brings us to the question and answer segment. And the first question has to do with the vaccine. And the question is, does the vaccine take over the immune system, the natural immune system?
The simple answer to that question is no. The immune system is the system that helps to help us fight off diseases. Even by you having an intact skin, which serves as a barrier between the outside and the inside, that is part of your immune system. We have our cellular immunity, which means that there are a number of white cells that help to fight off infections. We have cells that produce antibodies that help to fight off infection. The vaccine helps to augment the immune system in that it helps you to prepare antibodies so that they can be ready to fight off the virus when it enters your body. And so basically, it has you in a state of readiness to make sure that you don't suffer from severe disease, you don't be hospitalized, or you don't die from the vaccine, from the virus. It does not take over and control your immune system.
Thank you very much, Dr. Wilkinson. These next questions are from Vaughan Radio. The male that entered St. Kitts illegally last week via a fishing boat and was apprehended by police last Tuesday at a Buckley's residence, was the house vacant? If not, will the person or persons be charged with aiding and abetting an illegal fugitive? And should they be in quarantine as well? And what are the charges that will be given to the individual for entering St. Kitts illegally? Superintendent.
Thank you for that question, Mr. Williams. Yes, the house that the person was staying was vacant. There was no one occupying the house at the time. The house was vacant prior to him coming to the island. He would have breached the door to get in, and so there was no one living at the premises. The investigation is still ongoing, and appropriate charges will be brought at the end of that investigation. Thanks.
Thank you, Superintendent. This next question, will the herd immunity be collectively or individually for St. Kitts and Nevis? bearing in mind that St. Kitts is up to some 14,000 plus, and Nevis is at 4,000 plus, just a little more than the number of persons fully vaccinated. And the second question, if St. Kitts continues and reaches the given immunity status and Nevis doesn't, what will happen?
While on the dashboard, we list the doses given in St. Kitts separate to the doses given in Nevis. We are one federation, and so what we look at is the cumulative total. And so the target population of 33,037, that includes residents of St. Kitts and Nevis who move freely between both islands. And so there is no separation, there is no Nevis reaching herd immunity before St. Kitts reaching herd immunity. It is the federation of St. Kitts and Nevis, and the totals are for St. Kitts and Nevis.
Thank you very much. That brings us to the end of our press briefing for today. I want to thank all of you who participated in today's press briefing. I want to thank the media for coming. I thank ZIZ and all the media who continue to partner with us. Next week, we will be back for another press briefing at 5 p.m. Until then, take good care, continue to observe the pharmaceutical measures that have been put in place for your own safety and security. Non-pharmaceutical measures. The pharmaceutical measure is the vaccine. So go out and take the vaccine. Until then, take good care. I am Les Roy Williams.